Hi class, my name is Tatiana Garcia and I'm gonna talk about infection control.
Infection start with an infectious microbe, so as bacteria, fungi, viruses, more. Then the reservoir is the place where the microbes live and replicate, so as people, hands, equipment, water, food, and animals. Then the port of exit is the place where the microbes live, so as coughing, sneezing, and breathing. The mode of transmission can be by contact, airborne, or by insert vector. The port of entry can be any point, any opening in the skin or mucosa of the mouth. Can be via sutures, catheters, or IV lines. Last one is the susceptible host is when the person is sick or is more prone to have this infectious microbe. Also, a non-immune person, an immune deficiency, babies, elderly. Standard precautions are precautions that we take for every single patient at all times because we don't know what they have and they can potentially have something and we are not aware of that yet. So we do this to protect ourselves and also our patients. Some standard precautions include hand hygiene, wearing appropriate PPE as needed, handle patient equipment, environmental cleaning, respiratory hygiene or coughing etiquette, and handling of laundry. Hand hygiene will be performed by you before and after patient contact, and also after wearing gloves or if you touch any surface. PPE is personal protective equipment that you will use as needed to protect your skin, clothing, or mucous membrane from potential splashes. Because again, we don't know what this patient has, so at all times we have to take the necessary precaution to use the right type of personal protective equipment to protect ourselves. So some types of PPE are gloves, gown, goggles, mask, face masks, or shield. One of the transmissions-based precautions is airborne. How are airborne diseases transmitted? They are transmitted when a patient coughs and sneezes. Whatever get our respiratory droplets to come out, and these respiratory droplets are germs, and these germs are a special type of germs with airborne. In airborne, and wherever the person sneezes, that germ comes out, and if it survives, is turned into a droplet nuclei, which is a very small particle that is going to stay and float in air to wait to be inhaled. That's why it's so dangerous, and that's why we had to use a special mask, which is a N95 mask, because the particle is too small and easy to inhale. Airborne patients must have a ventilation room that clean the air out because these particles stand there in air and the transmission is inhalation. So if you inhale, it goes down into your respiratory tract and it starts to live there and grow. It's a special ventilation room, which is an airborne infection insulation room, also called a negative pressure room. And what happens is that keeps the pressure lower in the patient room than the outside room, and it will perform 6 to 12 air changes per hour. to keep those particles droplet nuclei as low as it can, and the door needs to be closed at all times. Some diseases that are included in airborne are chickenpox, disseminated herpes, measles, and tuberculosis. It's important to know that chickenpox and disseminated herpes are also a contact precaution. Now let's look at droplet precautions. Droplet diseases are transmitted when the patient coughs, sneezes, and talks. These droplets are a lot larger than the droplets with airborne, and they travel less distance. Diseases with droplets are epiglottis, flu, meningococcal disease, sepsis, pneumonia, meningitis, mycoplasma pneumonia. For droplet precaution, there is no special air ventilation required because it doesn't produce that droplet nuclei, that is those particles that happen in airborne. Now let's look at contact precaution. In contact precaution, these organisms are transmitted from the direct or indirect contact from the patient or something that the patient has touched. So you can be infected not only by touching the patient, but everything that the patient has come in contact with. So it's very important that when we are in contact with these patients, we wear gloves and gowns at all times and follow the standard precautions. Be sure to clean the radiographic room after the procedure with a contact precaution patient because not only we can get infected but also other patients. Some diseases in contact precaution are medication resistant diseases such as MRSA, VRE, ESBLS, also hepatitis A, diarrhea infections or unknown origin, conjunctivitis. There are much more contact precautions that I couldn't include here. Thank you for watching this video. I hope you enjoy it.